Hello? There we go. Good morning, everyone. Wow. Welcome to day 2, the Zero National Mental Health Symposium and Mental Health America Annual Conference, from housing to recovery, building community, building lives. Don't know if you saw today's paper on the front page of in the Tulsa World local section about the Habitat build and the dedication yesterday. How many of you were at the dedication? Raise your hands. Look at that, a lot of people. It was a great turnout and got a lot of coverage and stories about that. So we appreciate that. And Gayla and her family will be here tonight at the dinner, so you'll get a chance, if you haven't had a chance, to come up and congratulate them on their new home. Did everybody have fun last night? Trolleys? Rooftops, Blue Dome, Cherry Street, Brookside, Delks, Baxter's Interurban. I was there. It was fun. We had a great time. I want to, on behalf of Mental Health America and the Mental Health Association in Tulsa, we are so honored that you are here. I did this yesterday, and I want to do it again, and just let me get my camera here just for a second. Okay, now, if you're here from out of state, raise your hand. All right, hold it. All right. Whoops. There we go. I'm going to send that out all over the country. A reminder each morning to sign in at the registration desk. Don't jump up and do it now. You can do it anytime this morning. That's particularly important if you are obtaining your continuing education credits. Many of you are. I'm one of those. The mayor and his wife, Dewey and Victoria Bartlett, we have met with them earlier this year, and they just got really excited about they honestly didn't know as much as we wanted them to know, but Mrs. Bartlett went out on a housing tour. She just went wild. They really got to understand that Tulsa, Oklahoma, like many of you in your communities, we're about the business of ending homelessness, creating a place where everybody belongs, where everybody lives in recovery in the community, and that's one of the foundations of making a strong community. And they really got in the spirit of this, and they really hated it because they had we went to invite them to be here, and they were very gracious, but informed us that they had a long-standing scheduled trip to Japan on economic development for the city and area, but the mayor really wanted to communicate to the attendees about the conference and to welcome everybody. And so I'm going to step aside here, and we're going to watch a short video. He made a video to welcome everyone, and we're going to show that right now. Thank you.
Well, hello. My name is Dewey Bartlett. I'm the mayor of the city of Tulsa, and I have the pleasure of welcoming you to Tulsa. I know that many of you have come from all around the country to attend the National Zero Mental Health Symposium that we're holding this week. You are really going to enjoy Tulsa. I know that, but I'm also very proud to be able to show off the commitment we have to deal with the homeless situation that we have in our community. With leadership from the Zero families and other foundations, in partnership with the City of Tulsa, the County of Tulsa, the State of Oklahoma, and a broad spectrum of nonprofit housing and service providers, we have been able to reduce chronic homelessness to 63 individuals in the last count conducted in January of this year. In fact, the 100,000 Homes campaign, which has 151 participating communities, recently named Tulsa #2 in the country for the percentage of chronic homeless people being placed into housing each month. We're very fortunate in Tulsa. We have a very giving community, a very charitable group of people that live in this city. We also have several foundations that are committed to helping our community. The Zero Foundation is a perfect example of that. We have a very collaborative approach to trying to solve problems such as homelessness or gang intervention, whatever the variety of problems are in our country. But with the local commitment we have as a community to deal with homelessness, it's one that we approach as a group, and we have good measured success. We try to solve the problem by involving the entirety of the issue, not just the individual, but the individual's situation, the individual's family. Try to find job creation opportunities, everything. I mean, it's a very intensive approach, but it involves so many things. We all understand that. But when you do leave Tulsa, please come back, because we really enjoy showing our city off, but we also enjoy the opportunity of learning new ways to approach ways of fixing problems. So don't forget us, give us a call back. Next time you're in town, I hope to meet you and shake your hand and say hello and give you a little good advice and some things to do here in town while you're here. So welcome, enjoy yourself, see you soon.
That's very, very kind of the mayor and Mrs. Bartlett. They have been wonderful and are great partners with us. At this time, I'd like to introduce my colleague, Greg Shin. And Greg, if you'll come up. Greg Shin, many of you have know Greg if you're locals or in the state, but if you're from out of state, get a chance to meet this guy. He came to us 11 years ago from New York City, and was working with the homeless population there, and came to Tulsa and moved here with his family. And he's been my partner and our associate for that period of time, and has become nationally known for his expertise in housing development and operations of supported housing. So Greg, come up to the microphone and introduce our next speakers. Thank you, buddy.
Good morning, everybody. I'd like to introduce our first two speakers this morning. We're very, very honored to have them. They're both national leaders in the movement to end homelessness. Our first speaker is Jeff Olivet, and he's been a leader on issues of homelessness, poverty, public health, and HIV since 1993. As an outreach worker, case manager, housing director, activist, writer, teacher, and organizational consultant. For 2 decades, he has worked with organizations across the United States, South Africa, Kenya, and Nigeria to improve quality, develop and implement strategic plans, strengthen leadership and management structures, and streamline work processes. He's the chief executive officer of the Boston-based Center for Social Innovation, an organization that's committed to improving the lives of vulnerable people by whatever means necessary. Mr. Olivet and the Center for Social Innovation are leaders in the war on homelessness. Among other things, Mr. Olivet and his team work to educate communities and help organizations learn and implement evidence-based practices that support the successful recovery of formerly homeless families and individuals across the country. Based on extensive research, Mr. Olivet has put together a fascinating study about the history of homelessness in America, which I think that you will really enjoy. Now, please help me welcome to the podium Mr. Jeff Olivet.
Good morning. It's very good to be here with you all today. It's good to be in a room of maybe like-minded people, if there is such a thing. I'm going to make some assumptions to start with. I'm going to assume that you're here because you care deeply about recovery and that you believe people can and do recover from mental illness, from trauma, from homelessness, from addiction. I'm going to also make the assumption that you're part of the solution in ending homelessness in the United States. Now, those could be dangerous assumptions, but I think we're on safe ground. We're going to be really blessed at lunchtime today to hear from Dr. Mark Vonnegut. And Mark and I were talking before we got started this morning, and in some ways saying that the people who need to hear these messages are not the ones in the room. You all are the choir in many ways. You're the people who are already committed to recovery and committed to ending homelessness. I want you to be thinking this morning and throughout the rest of this conference about how you can be a stronger voice out in the world. Many of you are already, but I hope that you'll take the messages and the inspiration that you get here in this room of passionate and committed people and move it out into the world. With that in mind, I'm going to start by asking you a question. And because this room is both freezing and dark, I'm going to give you a chance to actually get out of your seat. And I do this at my own peril because there's a clock here timing me. And you guys could just keep talking for half an hour and I'm done. But what I want you to do is get up out of your seat and for about 30 seconds, find somebody nearby and say, what would it take to end homelessness? If we were going to end homelessness in the United States, we would need to ... Okay? Get up. This is going to be quick. Just take a minute or so. Just take a few more seconds and finish up those conversations. Just a few more seconds and then head back to your seats. All right, go ahead and head back to your seats and sit down and we'll get going here. I told you it was at my own peril. Sometimes it feels like we get a little stuck. It feels like we get stuck in the same ways of thinking about things and in the same ways of doing things. And it to me seems like it's helpful and healthy and right to step back from our work sometimes, to step back from the issues that we care deeply about, and to put our work into a larger context. And that's what I hope that we can do this morning, certainly in my comments, and I think what you hear from Linda in a little while around the 100,000 Homes campaign. I hope that you'll be able to stop and think and reflect. One thing that I want to do is to put our work in ending homelessness and in creating pathways to recovery in a larger context, in a larger historical context, and in a larger national policy and advocacy and trends context. So first what I'd like to do is look back. Now when I got involved in homelessness work in the early 90s, I was essentially told homelessness is a new problem. We created it in the late 70s or early 80s when we began closing the mental hospitals through the 60s and 70s and when veterans were returning from Vietnam and when we started really slashing our federal investment in affordable housing. Now, all of that is true. All of that contributed to and helped drive the current spike in contemporary homelessness, of which we are a part these days. But homelessness in the United States has a much deeper, much more complicated, and much longer history. And I think it's important that we look back. So what I'd like to do is start this morning by looking way back. The first cases of homelessness in the United States can be traced back to colonial days. back to the 1640s, in fact, in cities all along the East Coast. Obviously, the Mayflower came over, landed on Plymouth Rock, or as Malcolm X said, Plymouth Rock landed on us. And all was sweetness and light. The Europeans got along beautifully with the native people. There were no problems. There haven't been since. You all are in Oklahoma, you know that. There were problems from the beginning. And one of the issues was that the white settlers were moving into territory that was traditionally Native American, and this caused all kinds of conflict. There were frontier wars throughout the 17th and 18th century that displaced people on both sides. There were plenty of Native American people displaced in places like Connecticut, Rhode Island, Massachusetts in the course of King Philip's War in the 1670s. But we also saw white settlers who had moved out into the frontier being pushed back to the coast cities like Newport and Baltimore and Boston, who ended up literally on the streets, living on the docks, living in alleys with no place to go. The other thing that we saw happen throughout the colonial period was the inheritance of English poor laws. So these date back to the 1500s and 1600s in England. And the basic gist of it is that you had to prove to a community that you belonged there. And in order to do that, you had to make a case, in the case of our colonies, you had to appear before the city fathers and say, I'm going to be able to pull my weight in the community. I'm going to be able to farm my land, build my home, contribute to the faith community and the life of the community. And if you couldn't, you were basically told to move on. And if you think about who might have been left out in that picture, people with mental illness, people with physical disability, people with addiction to alcohol, orphans, elderly, anybody who was not perceived to have the ability to contribute to society and pull their own weight. And what happened is that through the 1700s in particular, we saw a wandering class of people literally going from town to town, displaced, homeless, and showing up in a city, and the laws of the city basically said, sorry, you can't stay here. During this period, we saw the emergence of almshouses for the first time in about 1734 in New York City, then Philadelphia, then Boston. These were in many ways the default prison, homeless shelter, and mental hospital all combined. And the conditions were horrific, and they did not particularly contribute to a path of healing and recovery. So if we start moving beyond the American Revolution and into the 1800s, into the 19th century, we see the urbanization of the United States. So we see people moving from rural areas, from farming communities, into the big cities. And we see the emergence of industry and the emergence of big factory towns and all of that. I'm going to get to that in just a minute. But the other trend that we saw through the 1820s and 30s was the first major federal policy that contributed directly to homelessness. And make no mistake about it, the policies that we set as a nation can make or break homelessness. They can fix homelessness or they can exacerbate it. Make no mistake about that. I grew up in Alabama, and in fourth grade, we studied the Trail of Tears, during which the federal government rounded up Creeks and Choctaws and Chickasaw and Cherokee and Seminoles and others and moved them over the course of a very disastrous and painful couple of years to this neck of the woods. And that was literally the first major federal policy that displaced people by the hundreds and hundreds of thousands. Back to urbanization. Urbanization in the United States aligned also with the emergence of police departments. This is really interesting. Police departments became the de facto shelter system in the 1820s and 30s. If you look at the records from Philadelphia, people were literally rounded up on the street every night, put into a jail cell, and then released the next morning. Jails became the de facto shelter system. We also saw hundreds of thousands of people moving into the cities hoping for work. This may sound familiar to you. And the work just simply wasn't there. Neither was the housing, neither was support with health care or education or anything else. By the 1850s, we saw the emergence of a different group of people that we had not quite seen before, and this was youth homelessness. There was a terrible recession. We've overused that word over the last 2 or 3 years. There was a terrible recession in the winter of 1853, And what we saw was young boys in particular ending up homeless all over the streets of the United States. And what happened is that a lot of families said, sorry, we can't support you, we can't feed you, we need you to go out there and make it on your own. And so we saw homeless youth on a very large scale for the first time in the 1850s. Then the Civil War comes around. And one thing that happened by the Civil War is that battlefield medicine had gotten so sophisticated that they could actually help people survive injuries that would have been fatal even 20 or 30 years earlier. And if you think about the parallel with our current war in Afghanistan and the recent war in Iraq, our battlefield medicine has gotten so good, in a way, that people are returning from war with traumatic brain injuries and with other physical injuries that would have killed them in Vietnam. And they're surviving now. The similar trend was happening during the Civil War. So you saw people like the gentleman in the middle of this picture, standing next to the boy, who's missing a leg, missing an arm. We saw tremendous numbers of disabled veterans after the Civil War. We also saw many tens of thousands of veterans with post-traumatic stress disorder. We didn't have the DSM yet, we didn't have the label, we didn't have those letters to go with it, but there was certainly PTSD after the Civil War. The deployments were long, 3.5 years in some cases, battle after battle after battle. These Civil War soldiers also learned how to live off the land. They learned how to tramp. They learned how to go out bumming to get the bullets they needed, the boots they needed, the clothes they needed, and the food they needed. So the terms tramp and bum were born. Right after the Civil War, another thing that was happening was that the railroad was extending throughout the United States and making us, for the first time, a truly mobile society. And the people who hit the rails were, in many cases, those homeless veterans, many of whom had addiction issues, many of whom had mental health problems. And they ended up emerging as a hobo tramp class for the next 30 years. We also saw terrible recession in the 1870s, where the overall economy was just absolutely terrible. And you can trace every time there's a recession, every time there's a depression, every time there's an economic dip, every time unemployment goes up, we see numbers of people who are homeless increasing. It happens every time. And I would argue that with this recent recession, the only reason it hasn't been worse is because so much of what you all are doing is working. There's such a focus on housing first. There's such a focus on ending chronic homelessness. There's such a focus on ending veteran homelessness that we've been able to stem the tide a little bit. At the same time, we've seen many, many thousands of people slip over into homelessness over the last 2 or 3 years who never thought they would ever be without a home, without a community, without a job. And that was happening during this period as well. Affordable housing was essentially non-existent. This is some of the tenement houses in New York City. This is very well documented in the weekly magazines of the 1870s and 1880s. This is what affordable housing looked like in New York City in 1869. And you can see people paying a few cents at the door to come in and flop, in many cases on the floor of a saloon or a bar or a gambling house. You see single adults mixed in with women with babies. People just crashed out on the floor. Another image from around the same time, this is the early 1870s, shows what you might get for a couple of pennies in New York City as well. To me, this looks more like the concentration camps in World War II than it does like any reasonable semblance of affordable housing. By the turn of the 20th century, we still saw homelessness. It did not go away, and it's been really interesting. We've seen these waves and troughs of homelessness. You heard me talk at the beginning about the fact that we're in a contemporary spike in homelessness over the last 30 years. That's absolutely true. It's the worst since the Great Depression. And we've seen spikes in our history, and you've heard me talk about a few. The spike during colonial times, the spike during the Industrial Revolution, the spike right after the Civil War. And often what happens is as the economy turns around or as there's a political backlash to letting poor people, people with mental illness, people who are homeless slip through the cracks, sometimes that pendulum swings back. And we do a better job with public policy, we do a better job with philanthropy, the faith community gets involved. During this period of the late 19th century, we saw the faith community get very involved. We saw the emergence of the Union Rescue Mission movement, of the Salvation Army, of organized philanthropy that really funded programs. Now, one thing that happens with philanthropy sometimes is that and this is true with the faith community and with the public sector as well, is that sometimes we think we know best, right? The people with the money, the people with the resources, the haves, feel like they know what the have-nots need. They feel like they know what people who are homeless need. Now, I would argue that people who are homeless and people with mental illness ought to be part of every single conversation, every single movement, every single policy decision, every single funding decision. It makes a difference because they are the people who know best what is working and what is not working. An example of this is in the 1880s in the Upper East Side of New York City, the Upper East Side Women's Potted Plant Society, this is fantastic, they decided that every kid in the Bowery needed a green plant to grow in, to bring a little life and a little responsibility and a little commitment to something. And so they raised a bunch of money from their wealthy friends. They bought a bunch of potted plants. They took them on a truck down to the Lower East Side. And they were there ready to hand out these plants. And the kids mobbed the truck, took all the plants and sold them. Good for them. They did what they needed to do in that moment to survive, right? The people making the decisions don't always have the answers. Any solution to homelessness has to involve everybody. It's got to involve the faith community, the business community, our elected officials, and most importantly, people in recovery themselves. They've got to have a voice, and you all are already that voice. Many of you in this room have experienced homelessness. You've experienced mental illness. You've experienced horrific stuff that many people in our society don't understand. They need your voice teaching them and shaping public policy. By 1911, we started getting a little academic. The University of Chicago released the first study on homelessness. This is Alice Solenberger, who interviewed 1,000 homeless men. The drawing there is from, oh, sorry, let me go backwards there for a second. Oh, you're jumping ahead to my, I can't stop it now. The Mississippi River is rushing on. We'll get back to I'm going to pause that for a second. Let me talk about Alice Solenberger. The drawing that you saw there was Skid Row in Chicago in about 1923. And we saw through the early part of the 20th century an emerging underclass in society, many of whom were single men with alcohol issues. That was sort of the stereotype, and statistically it held up. I mean, when Alice Solenberger interviewed these 1,000 homeless men, there was a sort of a more homogenous group through the early part of the 20th century. Now, what's undercounted in that are African Americans who were moving from the south to the north, women and children who were sometimes doubled and tripled up and not sort of part of the shelter system, so it's a little hard to get a read on. The other thing that shifted in the 1920s, and here we'll talk Mississippi River, a tremendous natural disaster occurred in 1927. The Mississippi River flooded from Missouri and Illinois all the way down through Mississippi and Louisiana and Arkansas. This is where Johnny Cash sings about how high is the water, mama, 5 feet high and rising. It's where Aaron Neville sings about Louisiana 1927. They're trying to wash us away. They're trying to wash us away. If you think about Hurricane Katrina as a driver of homelessness in 2005 and beyond, there is a precedent in 1927. The Mississippi River flood displaced more than 1 million people, many of whom stayed homeless for a long period of time after that flood. We also saw during this period the first federal response to natural disaster. Herbert Hoover, who had actually led the relief effort in Belgium after World War I, was hired by Calvin Coolidge, the president at the time, to run the relief effort. They segregated the camps, as you can see in the video here. There were black camps and white camps. The black camps often forced men in particular under armed guard to rebuild the levees. It was a period of re-enslavement of African American men in 1927 and 1928. Like Hurricane Katrina, the people who were able to rebuild after that storm were often the landowners, the wealthier and more predominantly white folks. This was one of the factors that drove some of the great migration of African Americans from the south to the large cities of the north. And you can see the armed guards here at the Black Relief Camp. In the video here from the Army Corps of Engineers, you can also see the reward system for clean shelters here. The neatest tent wins the prize. So if you really took good care of your space, you get a little ribbon. There it is. There's a little ribbon. People were displaced by this natural disaster, as I said, for 2 or 3 years. This was before the stock market collapse of 1929. It was before the Great Depression. But it illustrated two things. It illustrated that natural disaster is a driver of homelessness. And you can look at it at any natural disaster in our history. Katrina is the most profound and most recent. There are people still homeless in New Orleans and Baton Rouge and Houston and Biloxi and Jackson as a result of that storm. And if you've not been to that Gulf Coast since Hurricane Katrina, I would recommend that you go, partly to bear witness to the rebuilding, partly to be part of the solution, and partly just to be in solidarity with our fellow Americans who are struggling there. This is one of the relief camps after the Mississippi River flood. Then the Great Depression hits, 1929, really all the way up through World War II. And this gives us a point of reference to compare our current recession to. The current recession's been terrible. Hundreds of thousands of people have lost homes, have lost jobs, but it pales in comparison to the deep poverty and tremendous unemployment and huge numbers of people experiencing homelessness that we saw during the 1930s. We saw women, we saw children, we saw elderly, we saw mentally ill folks, we saw black, white, Native American, everybody experienced homelessness during these days. Now, the other thing that we saw was an incredibly effective response to homelessness. For the first time, the federal government got very involved in ending homelessness. There were work programs, there were arts programs, there were shelter and food programs, there was an investment in affordable housing. There was a program called the Federal Transient Service, FTS, that was in existence from 1933 to 1936 and provided an exit from homelessness for untold numbers of folks who had become homeless as a result of the Great Depression. In 1936, the FTS was collapsed into the federal funding stream that would eventually fund Social Security. So it was an effective program that was then channeled towards a larger safety net for all. But it showed that when we as a society, we as a nation, put our minds to something, we can fix it. I believe down to my toes, in spite of this long history, that we could end homelessness if we decided to, as a nation, as a funding priority, as a collective of people coming at this from a lot of different perspectives, Democrat, Republican, public, private, faith community, philanthropy, and as I said, people who have experienced homelessness. If all of those folks could get going in the same direction, we could end homelessness like that. We know what works. I'm going to get to that in a minute, and so is Linda. After the Depression, World War II came on, and we saw homelessness really subside into the Skid Row areas of our large cities in the United States. Unemployment went down below 4%, unimaginable today. People went back to work, the country went to war, we had an emerging middle class after World War II, and until the Vietnam War, the numbers of people who were homeless during that period, from the 1940s to the 1970s, was actually very small. Homelessness existed, but again, it was often single adults, often men, living in Skid Row, flop houses and rooming houses. The problem had receded from view, and so when we entered into the current spike that we're in now, it felt new. I think that's where that perception comes from. It felt new in the late 70s and early 80s, and people started connecting the dots with the Vietnam War and veterans returning with PTSD, with drug and alcohol issues, with difficulty reconnecting with family. That coincided with the closing of the back wards of the mental hospital. This is Dexter State Hospital in Rhode Island. I grew up 2 miles from Bryce Hospital in Tuscaloosa, Alabama. My uncle was there for decades and didn't have to be. So I think there was certainly very good advocacy and very good thoughtfulness that went into deinstitutionalization. The problem is we never put the community supports in place to meet the need. We never put enough housing units in place. We never put enough social supports and avenues for reconnection in the community. We never provided enough access to mental health care and treatment, to detox services, and to job training and everything else. So again, we know what works, we just haven't scaled it up. So when we come up to the present, as you all know in this room, I don't have to tell you all this stuff, but we see homelessness among men, women, children, people with disabilities, returning veterans, I mean, people who should not have to experience homelessness, we have let slip through the cracks in our society. I live in Cambridge, Massachusetts, about a 5-minute walk from the gates of Harvard University. In the background of this image are the gates of Harvard University. In the foreground is a woman with all of her earthly belongings, 20 feet from the richest institution on the planet, or one of them. I haven't compared it to Apple lately, but Harvard's got a lot of money. Many people living in Harvard Square don't. We're seeing a tremendously growing gap between rich and poor in this country. And until we fix that, until we solve that economic inequality, we will experience homelessness on a massive scale. We've got to close the wealth gap, we've got to close the income gap, and we've got to provide enough support for people who are struggling to get back on their feet again. So what can we learn from all of this? We can learn that homelessness has been with us. It's been endemic in our history. It's sort of always there at a low level, but at times it becomes epidemic. At times it becomes present on a scale on our national landscape at which the problem seems unsolvable. And I would argue that we're in one of those epidemic times in our history of homelessness. But it is solvable. We know what works. I'll talk about some of those things in just a minute. We know that the history of homelessness has always been and continues to be about race, class, gender, and disability. If you want to think of it this way, the history of homelessness in the United States is a history of who is considered to be expendable. And I hate to say it like that, but it's true. People with mental illness, women, orphans, the elderly, children, youth, it's who we are willing to write off as a society. And that changes over time. I mean, if you think about the community of people who are without sight, if you think about how our community, our country has responded to blindness, 100 years ago, there were tons of people who were blind out on the street, begging, asking for money. They had no system of support, no help. That has shifted, and it's shifted through advocacy and through resources. The same has happened with the developmental disability community. I think has done, in a lot of ways, a very good job to prevent homelessness, to provide the supports that people need not to slip over the edge. We know that war, natural disaster, and deep poverty are always there. These are constant drivers of homelessness. We should not be surprised anymore when veterans return from war and end up on the streets. We should be prepared for it. We know that people experiencing homelessness have often thought to be one group, but they never are. I know when I got into homelessness work, people would say, "Oh, how nice." Do you ever get that? What are they like? Do you ever get that from nice church people or friends and family at Thanksgiving dinner? There's no them. There's no such thing as the homeless. And if you find yourself using that phrase, the homeless, stop it. There's no such thing. What we're talking about are individuals, people with lives, with hopes, with dreams, with sadness, with loss, with skill, with passion, with smarts. We're talking about people. Are they nice? Well, yes, some are. Some aren't. How about people in this room? No, all of you guys are nice. I'm not going to go there. Go across Tulsa. There's a range of people. That's what it's like when we talk about people who are homeless. There's never such thing as the homeless. Ultimately, we know that homelessness is about two big things. It's about the unequal distribution of wealth and income, and it's about lack of affordable housing. If you could fix those two things, you fix homelessness. There's a lot more to it. We need to fix our mental health system. We need to fix our education system. We need to provide employment opportunities. We need to do a lot of things. But if we could fix the income gap, and if we could fix the affordable housing problem, we end homelessness. Then there's more work to do on top of that. This is the growing income gap, and this doesn't even take us through the recent recession, but you can see the rich keep getting richer, and the poor just keep bopping along at the bottom. One way to think about this is homelessness is like a game of musical chairs, and the chairs are affordable housing units. Now, I've got 2 kids, one of whom is a 5-year-old, so I end up going to 5-year-old birthday parties. And I don't know if you've been to a 5-year-old birthday party and played musical chairs or watched it. Who wins in a game of musical chairs? Right, the strongest, the one with like the really good sort of butt move there at the end and can kind of get, the one who sort of times it perfectly. And right? It takes some smarts, it takes some savvy, it takes some strength. If you think about who gets the affordable housing units, it's people who can best navigate the system, people who can best hold a job, people who can best deal with a landlord, with neighbors, et cetera. People who slip through the cracks are often people who need the housing the most. It's a nasty game of musical chairs. HUD estimated that there are something like 32 affordable housing units available for every 100 extremely low-income renters in this country. That's 2011 data. That is a nasty, nasty game of musical chairs. The math does not add up. That's the gap we have to close. We know from the National Low-Income Housing Coalition, every year in this country, the Out of Reach report says that there's not one county in the United States, not in Oklahoma, not in Alabama, not in Alaska, not in Massachusetts, where you can afford a one-bedroom apartment on the minimum wage. You've got to be working 2.5 jobs to afford a 2-bedroom apartment. We know that 1 in 50 children in the United States experience homelessness each year, and we know that hundreds of thousands, if not millions, of people experiencing mental illness end up on the streets of this country. Can we end homelessness? You've heard me say this, absolutely. And here's how. We know what works. We've piloted a tremendous number of things. Now we have to scale it up. One thing that's been exciting to me in the last 10 years is that our vocabulary has shifted. Until about 10 years ago, we were talking about managing homelessness. We were talking about emergency shelter. We were talking about food aid. We were talking about Band-Aid solutions. This is all good stuff. It's vital. It has to happen. But the dialogue has shifted, and it's shifted towards ending homelessness. And that's new. That's different. And that has not been true in the several hundred years I've been talking about this morning. I think we as a society are beginning to believe that we can end homelessness if we want to. One thing to do that we need to do more of is homelessness prevention. I think there are some good things going on around early intervention in the courts, certainly around trying to catch people right before they become homeless. I think we need to do a better job at this. I think there's a lot to learn. The shift towards housing first and rapid rehousing has been tremendous, and it marks a real sea change in how we respond to homelessness in the United States. It's one of the most exciting things happening. I think we also know that it's not just about housing. It's about housing and support, that people don't just need a roof over their head. They need community. They need services. They need support to rebuild connections and to get back on their feet. So it's not just solve housing and then we're done here. It's provide people community and provide people the supports they need to thrive. I think the trend towards evidence-based practices, while tricky and controversial, has been good in general. I think the idea that we don't have to recreate the wheel in every community is really exciting. I think 100,000 Homes and a lot of other groups are really leading the way on taking what works in one community and replicating it in other ones. That's the spirit of evidence-based practices. We know that things like outreach and engagement work. We know that our services should be trauma-informed and recovery-oriented. We know that the involvement of people in recovery makes a difference in quality and in depth and effectiveness of care, and we know that supported employment works. Can we end homelessness? Absolutely. And until then, you all, every one of you in this room, need to be a voice in your community, a champion for ending homelessness, a voice in the wilderness if you find yourself in a wilderness, and certainly a voice for those who are voiceless among us until they're in a place to have a voice for themselves. Thank you for being here. Thank you for your time this morning. I hope you have a great couple of days at this conference. Keep up your good work.
Jeff, thank you for that amazing portrayal and for really putting everything in context for us and kind of setting the table and providing inspiration, which we all need a lot of inspiration because this work is really hard sometimes. Now I'd like to welcome Linda Kaufman to the stage. Linda is the Eastern U.S. Field Organizer for the 100,000 Homes Campaign, a national project of community solutions. In this role, she's responsible for inviting communities and states to join the campaign working with them to determine which homeless individuals in the community are vulnerable, and in assisting and developing the resources. She's worked in homeless services in Washington, D.C. since the mid-1980s, and most recently as the Chief Operating Officer for Pathways to Housing in D.C. In addition to her work to end homelessness in D.C., she is also involved in other issues of social justice in the city. The 100,000 Homes campaign is an excellent example of the type of far-reaching strategic planning coupled with innovative thinking that it is going to take to end chronic homelessness in our country. We've heard from HUD, SAMHSA, the VA yesterday. We know about the U.S. Interagency Council on Homelessness, Pathways to Housing, the Corporation for Supportive Housing, National Alliance on Homelessness. There's a lot of great national initiatives out there, but I think it is safe to say that no other single current national initiative has brought more energy, exhibited more leadership towards the goal of ending chronic homelessness, or educated more communities on how they can actually do this in the last few years than the 100,000 Homes campaign. With an update on the campaign and information on how you can get involved, please help me extend a warm welcome to Linda Kaufman.
All right, I'm an Episcopal priest, and I just stay in the pulpit. So, cameraman, you can just like take a nap now. I mean, you know, Jeff just was everywhere. It is freezing in here, isn't it? So, just to get your blood flowing, would you stand up, stamp your feet, and just clap 12 times? Just come on, let's get the. Okay, I can now go back and tell my boss that I got a standing ovation at Mental Health America. Thank you so much. So I'm here to talk about the 100,000 Homes campaign, and I think there's no better way to do that than to start with a video. So if you would just play the video, that would be great.
They'll say, hey, look at him, I'll never live that way. That's okay, they're just afraid to change. When you feel life ain't worth living, you got to stand up and take a look around. Painted. Knows I fade away. They'll all look at me and say, they'll say, these days when life is hard, you have to change. life is hard, you have to change.
Thank you. As part of the 100,000 Homes campaign, we are reading a book called Switch by Chip Heath and Dan Heath. It's about change when change is hard. Their image of change that they use in that book is really 3 parts. It's a path to go down, an elephant, and a rider. The path is the system of change. And I'm going to talk to you about that in a minute, what we're talking about, the 100,000 Homes campaign. The rider is the part of change that's influenced by the intellect, influenced by outcomes and statistics. You know, that if you move someone from chronic homelessness to permanent supportive housing, their Medicaid costs drop by 60%. That the cost of housing someone is less than the cost of keeping someone homeless. That's what influences the rider. But you know what? The rider really doesn't have that much control over the elephant. I mean, really. The elephant is our emotions. The limbic part of our brain, that's kind of the alligator part. Now, I have to tell you, that video I just showed you, that is a shameless pitch to your elephant. I want you moved in your heart as you listen to what I have to say today. Well. So that's Ed Givens. Ed Givens lived 30 years on the streets of Los Angeles on Skid Row. He was one of the most vulnerable people we found in Los Angeles, and one of the first people that moved into housing. And after he moved into housing, he started saying, I feel terrible. I don't like the way I feel. Can you help me go through detox? Not in order to get his housing, but as a result of getting his housing. And that is Ed Givens today. And the question for each of us is, which community do we want to live in? Do we want to live in that community or in that community? And because you are here, I believe that you want to live in that community with Ed Givens. For a long time, we were in the business of working with homeless people or providing homeless services, and as Jeff so eloquently said, we are now in the business of ending homelessness. You should read Opening Doors, the federal plan to end homelessness. Do you know what they say? The 5 underlying values in that plan to end homelessness as a nation. You should memorize this. Homelessness is unacceptable. Homelessness is expensive. It is solvable, and it is preventable. We have to collaborate to do that. And here's my favorite. There are no homeless people. There are neighbors of ours who have no place to live right now. That is what we are about as a country. By 2015, I believe with all my heart we are going to end chronic and veteran homelessness in this country, and it's going to take every one of us to make that happen. This is a picture of some men. I think they're all men, which is kind of sad. I don't know why it is, but this is a group of people receiving medical services from Healthcare for the Homeless in Boston. This picture was taken in the year 2000. You look at that picture, and I don't see people who look sick or are frail or look vulnerable. I just see kind of people, average ages in their 40s. Today, one of those men is still alive. Each of them was medically vulnerable, not in a way that they could see, but in a way that put their life at risk on the street. So how do we, as communities, make sure that we don't have this kind of mortality rate anymore? What other cohort in their 40s has a 90% mortality rate in a decade? The CDC would be all over it if it were anyone else. We have a responsibility. We have the opportunity to find out who among us is medically vulnerable and make sure they get housing and make sure they get the services they need. We use what we call a vulnerability index. It's based on the work of Stephen Wang and Jim O'Connell in Boston. In Boston, they started realizing a lot of people were dying on the streets, and they started thinking, what can we do about this? And they reviewed medical records, hundreds of them, and found that there actually were factors that you could look at, you could determine, you could find out who had those factors, and if you had been on the streets for more than 6 months and you had one or more of these medical factors, you had an elevated risk of dying on the street. So what are they? They're pretty simple, really. If you have end-stage renal disease, if you have a history of a cold weather injury, if you are HIV positive or have AIDS, if you have liver disease or cirrhosis, any of those medical conditions, and you've been on the street 6 months, you have an elevated risk of dying on the street. If you've been on the streets for 6 months and you are just my age, I'm 61, you have an elevated risk of dying on the street. Jim and Stephen were convinced that people dying on the streets of Boston were not getting medical care. But what they found was people who'd been in the emergency room 3 times in the last 3 months, or over the last year had combined a hospitalization plus emergency room visits adding up to 3, had an elevated risk of dying. And then for people who were mentally ill, substance abusing, and had any chronic medical condition like asthma or diabetes, they also had an elevated risk of dying on the streets. So that in itself helps us understand who are the most vulnerable, the most likely to die on the streets in our communities. So what do you do with that? The 100,000 Homes campaign has put together what we think is a way for communities to figure out who's medically vulnerable and then to prioritize that cohort of our community and put them in housing, using what Jeff talked about as housing first. So here's the model that we use at the 100,000 Homes campaign. You develop a team, a leadership team, and it's a team, the more factions kind of you have from your community, if you can get the continuum of care, if you can get the providers, if you can get the funders, if you can get the business community, the VA, the housing authority, and it occurred to me the other day, you ought to get the head of your Medicaid services to be on your leadership team. And you start planning for how are we going to do this campaign? How are we going to change this system in our community? And you do it by, the second step is figuring out who's vulnerable. You figure out who the most vulnerable people are in your community. And we have a very simple tool called the Vulnerability Index that allows you to talk to people and figure out who's medically vulnerable. We'll even throw in the database if you want to use our database. But you go out and you talk to people. We suggest you do a registry week. Train volunteers. 3 mornings in a row, go out and talk to people on the streets, interview them. Do it during your point in time count in January. If you knew at the end of your point in time not only how many people were homeless, how many people were chronically homeless, but how many people were medically vulnerable, likely to die on the streets, you've got information you can use for action in your community. So you go out 3 mornings in a row between 4 and 6 a.m. You talk to people, interview them on the streets. And at the same time you're finding that out, you're also lining up your supply. So you figure out the numbers, you do a press conference, you tell everyone what you found out, and you line up the housing supply. at the same time. And we quit saying that the 1% of housing resources that are dedicated to homeless people, we quit saying that that's enough. We have to get mainstream housing resources applied to people who are homeless. We have to get that the 2/3 of our vouchers that are used for everyone who's poor and get them prioritized for people who are going to die on the street. So you line up the housing, you move people in using a housing first model. So no one moves into housing because they're ready for housing or because they're prepared for housing or they're likely to be successful in housing. They move into housing because they need housing and they're the next person on the list of priority in your community. I believe Sam Sambaris is going to be here talking about housing first. You should find out about that because housing first is going to change the face of homelessness in this country, and it's doing it right now. And then last, after you move people in, you keep them housed. I have to tell you, this is the hardest work you'll ever love. Keeping people in housing, about 85 to 90% of the people you move in with the right supports will be able to stay in housing. And that's what we're about, is making sure that that 90% stays in housing. This is the ad. It's brought to you, sponsored by, the 100,000 Homes campaign has lots of partners. Mental Health America is one of those partners. We have lots and lots of partners. There's just a list of them. A couple that I'd like to point out, public hospitals are partners in this campaign. The National Association of Housing and Redevelopment Organizations, which is your local housing authorities, professional association, Pathways to Housing is one of our partners, Corporations for Supportive Housing. You can see our partners up there. This work cannot be done by any one group or any one person. It has to be done by a coalition. The National Alliance to End Homelessness partners with us. What a joy it is to have these partners. So there's my contact information. Now that's the end of the infomercial about the 100,000 Homes campaign. If you want to know more about it, I'm doing a workshop later on. I'd love to see you come to our workshop. I'm working with the National Alliance to End Homelessness for that. Okay, what I want to talk to you about in the rest of my time is why it is we do this work. What it is that stirs us to do the impossible work of recovery and housing and ending homelessness. So, why did you get in this business? Almost no one wakes up when they're, 8 years old and says, "Oh, I think I'll work in homeless services," or, "Oh, I think I'll work in mental health services," or, "Oh, I think I'll be a recovery specialist." I have to tell you, it's a gift, I think, and a grace that some of us fall into this and get to do this work. So I'd like to tell you a little bit about how I got here. When I was the director of Pathways to Housing, I always asked people two things. One is, do you clean toilets? Thank you for laughing. Thank you. And the second is, how'd you get into this work? And it was always fascinating to hear what people had to say. The reason I asked, do you clean toilets, is if you've lived like Ed did for 30 years on the streets of Skid Row, you may not know all the skills you need to keep an apartment. And someone is going to have to stand next to you and show you how to clean a toilet. I don't mean that if you're an MSW and you apply to work at Pathways to Housing that you're going to be cleaning toilets and being a domestic, but I do mean that you're going to have to roll up your sleeves and stand next to someone who doesn't know basic housekeeping skills, perhaps, and teach them how to do this. One of the skills I have that I am very proud of is I know how to auger out a toilet. I was going to do a video for YouTube on it, but then when I looked, there's already like a dozen videos of how to auger out a toilet. I mean, you could save your organization thousands of dollars if you know how to get something out of the toilet, because it's one of the things that people don't know is what goes down the toilet. Oh, this washcloth, it doesn't work anymore. I mean, it's really kind of filthy. And then it's just totally plugged up. You can get that out with a toilet auger. Skills. I mean, we all need skills, right? So how did I get into this business? When I was in seminary, a priest who worked in the inner city of DC came and talked to us at Virginia Seminary, and he said to us, "You Virginia seminarians are pietistically insular." And I thought, what does that mean? I mean, really, what does that mean? Okay, pietistic, oh, holy, insular. And he set that one out pretty clearly for us. He said, you live 10 minutes from downtown DC, and you come into the city to go to the Kennedy Center, to go to the opera, to go to the memorials, to go to the art galleries. You do not come in to do justice work. And I thought to myself that afternoon, he's right. I don't know if you've ever had a word spoken that just seared into your heart, but that one did for me. And I thought, I better do my life differently. And a friend of mine in seminary volunteered at a women's shelter, so I said to Marianne, my friend, can I go with you this Saturday when you volunteer? And she said, sure. So I went to Mount Carmel House in Washington, D.C., a women's shelter in Chinatown, run by Carmelite nuns, and I was moved and touched and changed like I had never been before or really since. I walked out of that shelter the next morning knowing a couple of things. One is that the women in the shelter were more like me than they were different from me. And secondly, that I had to do something about homelessness. This was in 1985. And I've been working at that ever since. I knew that we had to do something. I didn't know how to do it. I didn't know what was right. I didn't know, so I ran a dinner program for homeless women. I made sure they had something to eat. And about the early 90s, I started realizing that we could not only provide homeless services, but we could end homelessness. And I started working to end homelessness. And I continue to do this work for a number of reasons. In the 100,000 Homes campaign, if you use our database, your data rolls up into national data, and we aggregate that data and look at it all the time. And the reason I do this work is at least partially because, like 2/3 of the people who are medically vulnerable in this country, I have a mental illness. I tried to commit suicide in college. I spent years where every day I had to consciously decide, I am not going to kill myself today. I do this work because it's important, and I know personally that recovery is possible. I also do this work because, like 3/4 of the people who are medically vulnerable in this country, I have an addiction. I quit drinking on April 6, 1986, and I know what a struggle it is to just quit drinking, and I know what a struggle it is to become sober, and I know what a struggle it is to actually become a healthier person when not drinking. And so I do this work as someone who's not better than anyone else, but someone who understands some of the struggle. I also have an outside personality. I also have the ability to talk in public. I have the ability to believe with all my heart that you can't say no to me if I'm in the right. Those are skills that some of the people living on the streets don't have. So we get to put our skills to work to change things in this country. Ending homelessness is only going to work if we believe one thing. You ready? The cure for homelessness, ready, is housing. I know. Hey, who would have thought it, you know? I thought, you know, when I first started running the dinner program for homeless women, I thought there were women who would come in who just needed a kick in the butt, and they were going to change, and they were going to get jobs, and they were going to, you know, just go out, and they were going to be fine. But, you know, they'd have to work 2.5 full-time jobs in order to afford a place to live. I thought there were women there who were never going to be able to work, and that we would have to be providing dinners to them forever. And here it is. This is my arrogance. I thought I could tell the difference. The truth is, I cannot predict who's going to make it in housing. A friend of mine runs, he's an executive at Community Connections in Washington, D.C., the largest mental health provider in Washington, D.C. And Richard Bebout was convinced that he could use his skills as a psychologist, PhD, to figure out those things that would predict who would make it in housing. And Community Connections did this amazing thing. They started 25 years ago, and every time they got $10,000 together, or $50,000, or however much money it was, they would just buy another apartment building. So they have apartments all over Washington, D.C. So they've got lots of experience with people in housing, who makes it, who doesn't. So Richard ran those numbers every way to Sunday. He sliced them, diced them, took them apart, put them together, and he said, I have come up with what I can tell you about the predictor for housing and who's going to make it. He brought all that information to a meeting of the Behavioral Health Association in Washington, D.C., and he said, this is what I found. Here are the predictors of who's going to make it in housing. Anybody want to guess what they are? There are no predictors of who's going to make it and who's not going to make it. I can tell you this, though, if you don't offer housing to someone, they're never going to make it in housing. If you don't put someone in housing, they're never going to be successful in housing. If you don't believe that anybody can make it in housing, we are not going to end homelessness in this country. Housing first is the way to go. If you don't believe housing first works, come talk to me. I can tell you about it. In Washington, D.C., Pathways to Housing offers services, housing and support services to over 400 people, and 85 to 90% of them make it in housing. The people who came in under the 100,000 Homes campaign in Washington, D.C., Pathways provides services and housing to some of those folks. 95% of them were still in housing at the end of the first year. This is possible. Do you remember what it is we're going to do to end homelessness? Housing. Okay, just remember, that's the only thing. If you don't remember anything else I say, just remember, oh yeah, housing. So we're about housing. I want to tell you about a man I met named Sam. Sam grew up in Washington, D.C., and when I met him, he'd been living on the streets of D.C. for 20 years. African-American young man. He went to Dunbar High School in Washington, D.C., the preeminent African-American high school in Washington, D.C. He was valedictorian of his class at Dunbar. He got into that place you were talking about, Jeff. He got into Harvard. Full ride. He was the first person in his family to finish high school. He was the first person to go on to college, and of course the first person to graduate from college. He got done, he was pre-med, he finished, he got into Howard Medical School, got married, had a kid. He was just really on the top of the world. His family, imagine his family, how proud they were of their son, Sam, their brother, Sam. And sometime in medical school, his life imploded. 20 years later, after 20 years on the street, he could never tell us exactly what happened. He just didn't have the words for it. He knew that everything fell apart. When I met him, he looked kind of like an Old Testament prophet, a couple teeth missing, I mean, just this hair and beard, and we put him in housing. Up on Rhode Island Avenue in Northeast. Nice little studio apartment, really sweet. And 2 weeks later, Sam comes to me, and this was the first time I'd ever done anything Housing First-wise. It was before I worked at Pathways, and I didn't really know how to do this. But Sam comes to me 2 weeks in, he says, okay, I'm ready for a job now. And I'm like, really? Wow. So a friend of mine was head of food and beverage at the Grand Hyatt, so I went to my friend Michael and said, hey, Michael, I got this guy for you to hire to work at the Grand Hyatt. And he said, it's not one of your homeless guys, is it? And I'm like, no. He had an apartment, right? He wasn't homeless. Duh. So Michael says to me, do I get to interview him? I said, well, absolutely. Interview him to decide which job you're going to give him. Of course you have to interview him. And bless his heart, Michael did. Hired Sam, and Sam worked at the Grand Hyatt until he died about 1.5 years ago. He got his first check, and he came into my office and he said, can you tell me a phone number from the Department of Education? I said, sure. So I go on the internet and I look up a number for the Department of Education and I write it down for Sam. And I said, how come you want the Department of Education? He said, you know what? I defaulted on my education loans and I was thinking maybe now that I have income, I could start paying them back. Sam was so ashamed of what he'd done in his family that he couldn't even talk to his family once he got into his own place. But his first check, he bought a bathrobe for his mother and mailed it to her. It was months, but he finally was able to go visit her. Sam reconciled with his son, joined a church. There were some ups and downs in his work, but he kept his job until he died. And then his son called and told me that Sam had died. And we talked about the changes in Sam's life when he got housing. Seeing Sam on the street as I had, I wouldn't have bet a nickel that he would have made it in housing. But he did. Not because he showed he was ready for it, or prepared for it, or qualified for it, or any of those things, but because he got housing and lived into it. "200 years ago, we were a country where you could buy and sell another human being. I am proud to say we are not that country anymore. I believe, along with Martin Luther King Jr., that the arc of history is long. It doesn't veer toward justice quickly, but it does bend toward justice. 100 years ago, you couldn't vote. I couldn't vote. Because we were women, we could not vote. I am proud to live in a country where everyone gets to vote, and where it looks as though women may be casting the deciding votes this fall in our election. Women's issues may be determining factors in this election. 50 years ago, Jim Crow was the law of the land. And I am proud we do not have those laws anymore. Do I think racism has ended? No. I have 2 African American sons, young men who have struggled with being black men in this country. It's not over. But is it bending toward justice? I believe it is. This is my dream, brothers and sisters. My dream is that 20 years from now, we will look back and we will say, I am proud that we no longer have homelessness in this country. I believe that we can end homelessness, that we will be ashamed of what we have done by letting our brothers and sisters be homeless. And we will, with pride, in my 80s, I will look back and say, we are not that country anymore. We can end homelessness, and I am delighted to be in this work with you all. Let your hearts lead you. Know why it is you got in this work, and work your asses off to end homelessness. Thank you very much for letting me talk with you. Do we get to sit over here?
Sit over here. We actually have time for a few questions, but I think it's safe to say if you had burnout, you don't have it anymore. Jeff and Linda, what an inspiration. We know how to do this work now. We know what it takes, and now we're ready to go do it. We got a lot more workshops today, but before we do that, we're going to take just a few questions. We have just a few minutes, so if you have a question, please hold up your hand and we'll get the microphone over to you.
Yes, thank you very much for those inspiring speeches. I just have one issue, and it may be my personal perception of the world, but if you divide up all the homeless people by gender, I suspect the overwhelming majority would be men, not women. And there are men with children, particularly when women used to die in childbirth. So the phrase women and children is almost sacrosanct, but no one says men and children because maybe it's suspect. So I realize that primarily, oftentimes women wind up taking care of children. We lost more people in the Civil War than we did in all the other wars combined, 750,000, 2% of the population. So, you know, those men were gone. But I just a little uneasy with the categories race, class, gender, disability, and when you say gender, you reference women, because it obviously affects men too, maybe to a higher proportion.
Thank you for your comments. Do we have another question?
There's a lot of changes going on, and I'm really, I think it's a positive thing about this homeless. But I also know there's other efforts to suppress a vote, to cut off funding for the CARE Act and stuff like that. And so, you know, I feel at one hand hopeful, but on the other hand, I see in society something that's not very good. Do you want to comment on that mix? Maybe there's always been a mix of kind of pro or recovery or movement ahead, and then movement back.
Thank you.
I mean, I think you've got to fight like hell for the things you believe in. I think that's one thing. I think we also should always find where the hopeful spots are. And if you, Linda, you talked about the civil rights movement and the end of Jim Crow. The civil rights movement didn't come out of nowhere in 1965 with the Civil Rights Act and the Voting Rights Act. Mm-hmm. And it didn't come out of Rosa Parks on a bus in 1955 in Montgomery. It came out of the black soldiers returning from World War II with a passion for, you know, if I fought for this country, why can't I be an equal member in it? It came from Joe Louis and Jackie Robinson, and then it came from Rosa Parks and Martin Luther King and the kids at the lunch counter in North Carolina. So I think, you know, if you look at the long sweep of things, there are times when it feels hopeless. There are times when it feels more hopeful. Either way, whichever of those cycles we're in with regards to homelessness, mental health care, et cetera, I think you've got to recognize it for what it is, that we're in a tough time where we're maybe swimming upstream a little bit, but that makes the fight all the more important, so that when the breakthroughs come, like what happened in the mid-60s with civil rights, that the dramatic breakthroughs are built on the back of the 20 years of advocacy and hard work that came before that.
I also think we all have learned in our lives to live with both the hope and the hopelessness. That, you know, there's a in most of our lives, we're neither happy nor sad, but some combination of those, and I think we just live with that.
We have time for another quick one.
Yes, I'd like you to comment in looking at our child welfare system here in Oklahoma, and then I've discovered it's all over the country, that kids that are in foster care systems, what have you, and they generally are, in my opinion, not being well prepared for life after living in foster care and being turned loose, and the numbers appear that they're adding to potentially a future homeless population, incarcerated. I'd like to hear your thoughts about addressing that, and particularly putting it in the historical context that you mentioned about the young kids in our history that have been out on the streets. So I'd like your thoughts about that.
Sure. Do you want to take that first, or do you want me to?
I think you're absolutely right. I mean, I have two sons who came out of the foster care system, and both of them struggle with their move to adulthood. I don't know how many of you all here have raised your own children or adopted children to adulthood, but I think it's a peculiarly difficult time for people to launch. I mean, it's expensive, it's hard to get jobs, and it's a hard time. It's particularly hard for someone who hasn't had stability. So I think we as a community have some responsibility to figure out what are those skills that will be most helpful for kids moving into adulthood, and make sure that we're finding ways to work with kids to have those skills.
And I think I'll address this in a couple of ways. Going back to the earlier comment around gender, I think it's important that we don't divide and pit one subgroup against another. I want to say that very, very clearly, that something like 25% of people experiencing homelessness are kids under 18. I think if you watch the trend over the last 20 years, we've seen an increasing number of women becoming homeless. Historically, that comes and goes a little bit. You're absolutely right about the fact that the preponderance of people who are homeless are single men, and they're often written off. I think that's shifted a bit with the focus on chronic homelessness and the focus on veteran homelessness. But I think it's important not to split the pie differently, but to bake a bigger pie around funding and around resources. To the question of youth, because I think it's relevant in here, you always hear people sort of say flippantly that youth are the fastest growing segment of the homeless population. Veterans are the fastest growing. And I think these things sort of get thrown around. If you look over the last decade or so, youth seem to be somewhere around 5% of the homeless population, not really growing or shrinking. It's absolutely a vulnerable transition. And I think it ought to be dealt with in the same way that we deal with other, or that we should deal with other vulnerable transitions. If you think of discharge from psychiatric hospital, discharge from medical hospital, discharge from prison or jail, and discharge from foster care or transitional programs or whatever, and the military, that's right. I mean, and you could probably look at others, domestic violence, shelter, to housing. Those critical moments are where we ought to be providing more support, not less. And it's often where the ball gets dropped. And there are some really exciting models like critical time intervention, which is a so-called evidence-based case management model that does that, tries to bridge the transition. But I think all of us need to do a better job at making those systems talk to each other more and creating effective solutions that keep people from slipping through the cracks of one system before they get into either their own sort of stable independent housing or into a more supportive environment. Those transitions are absolutely critical. And right now we don't do a good job in those transitions.
And as Linda said, it's about housing. I mean, regardless of if the person's coming out of incarceration, or if it's a veteran, or if it's a youth that's transitioning out of foster care, institutional care, there's just not enough access. Right. There's not enough units. We do know what some of those models are. We do know evidence-based practices, supports that people need, but we still need the units for those people to go into, and then we can help work with them. How are we doing on time? Okay, so I guess we have time for 1 or 2 more questions. Do we have some from the audience? I have one for Linda that I'm going to save for the end.
There's one over there.
Now, when you were talking a while ago and you was talking about teenage homelessness or young people being homeless, right now in my neighborhood, I see a lot of young mothers that's not educated. They haven't finished school. They can get an apartment through THA, and there's nothing for them. I mean, no one works with them, teach them how to become an adult, much less become a mother. So then there she goes, and she gets evicted, so she's homeless, and her kids is down here at the day center with her and everything, and she's still not getting redirected. You know, and to me, I feel like it would be more, it seemed like it would be better to start there, and, you know, like working with the service coordinators that's in the properties, on the THA properties, and start trying to make these young ladies be accountable, because some of them is 14, they're not even old enough to get a job or old enough to draw benefits, but they're old enough to get food stamps and get this apartment, and then they get utility allowances for it to pay their bills and everything. So, you know, and without education, for lack of knowledge, man perish. And if we don't educate them, that's how we keep getting so many young, youthful offenders, or either so many violent attacks on our kids, because these young ladies are full of anger and feeling like failures, and they don't know how to direct their anger, and so they wind up beating their kids, and then the kids is in the system. It's just an ongoing cycle. So how could we better that?
I mean, I think you make a really good point that education is a major pathway out of poverty, out of homelessness, into stable income, and into breaking the cycle of generational poverty and homelessness. I think that's a very, very good point, and one that's often on the back burner of our service systems. I think another thing that I hear in what you're saying is that our solutions for homelessness are individualized to that person and their needs. I'm reading a little bit into what was there, but I don't think we can assume that there is a sort of standard service plan, treatment plan, set of hoops that every single person who has been homeless ought to jump through. What we ought to do is to create a flexibility in the services and supports that are provided, so that whatever is most important to this person right now in their transition from homelessness is what we can provide support to do. And that may look very different for the young mom that you described than it might for an Iraqi war veteran, or even a Vietnam veteran who's been on the streets for 20 years. That's going to look very differently. We should assume that there's not a one-size-fits-all service package.
I think the key is acknowledging that there are complex sets of problems and issues, but as Jeff's saying, they're different. For different people with different situations. And so the housing, getting them in, it's possible for somebody to fall back out of the housing, that's true, but we heard the success rates are really high if you provide the housing first and then work on those issues for that individual person to help them stay there. I think that's really the key. Do we have another one? One more.
It sounds like we really have an objective of building a culture of housing as opposed to a culture of homelessness. And I'm wondering if you can give us an example of communities where the necessary partnerships that have to be developed among businesses, other leaders, and so forth have demonstrated how it works, because it's not going to work if we don't find ways to build those partnerships. The partnerships have been a theme of this conference, too, not just around helping people who are homeless. But I'm sure you can give us some examples of places where this has been done really well.
I'll start. In Washington, D.C., really the Business Improvement District in the downtown area was one of the drivers for moving toward using the Vulnerability Index and Housing First, because they really wanted there not to be homeless people in the downtown area, because it was bad for business, it was bad for the people living on the streets, And they wanted that to change. So they were a driving force for that shift to happen. That shift, they became kind of a whisperer of Housing First and the Vulnerability Index and the 100,000 Homes campaign to the mayor. The mayor then said, wow, we can do this. He's saying to his deputies, we're going to do this and we're going to end homelessness. And he was saying to the head of the Department of Human Services, you either get 300 people off the streets who are chronically homeless between September and December of 2009, or I'm going to fire you. That was a motivation. The Housing Authority, working with the deputy at the Department of Human Services, really got it. And by the time we were 1,000 people into housing people in Washington, D.C., you could send over an application on a Tuesday and have the person moved in on a Friday, because the Housing Authority was there. All of the providers of services, at first, only Pathways to Housing wanted to do Housing First. And the city said, well, we have funding for people to do case management. So here's the case management money, but it's for Housing First. And then eight other communities and organizations said, well, we could learn Housing First. And, and they did an excellent job. As I said, 95% housing retention at the end of the first year. So it was kind of a cascading group of people who all made this work. It wasn't any one, but somebody has to be a visionary, or some group has to be visionary and say, if we do things differently and do them this way, we can make a serious change.
Great. Could I just make one comment on this?
Sure.
Too? Linda has made the point very, very well that housing is the prescription for homelessness. That is the solution. I would argue that in addition to that, the solution to homelessness is rebuilding the fabric of our communities. Yes. And this is the hard part. And it's not the clinical treatment part, and it's not the housing development part, and it's not the funding part. There's a wonderful book that was written a few years ago by Bob Putnam called Bowling Alone. And I don't know if any of you have read this. It's about the decline in civic engagement in the United States over the last 50 years. And if you think about each of us on our own little Blackberries and iPhones and in our homes, disconnected from friends and community and family, and we're an incredibly mobile society. That's the other underlying piece that I think needs to shift in a huge way in this country. And Putnam and others argue that that's cyclical as well, that that's not a forever decline. And so I would challenge you all, as you build these partnerships, don't just think towards housing development. Don't just think towards service provision. Think towards what it means to fully integrate people in a community, in a society. Yes. And that's not just a housing culture, that's a social inclusion culture for people with mental illness, for people who are living in poverty, for single parents, for everybody in our living in our towns and cities and across our country. That's the hard part, and that's the hard part to sort of nail down.
When you told us to go introduce ourselves and say what was going to end housing, I talked to a woman who said relationships and knowing people, and I said housing, and I think those two, the social integration and the housing with the right support services and the finances.
And the relationship stuff shouldn't let anybody off the hook for funding. It costs money to build housing. It costs money to do subsidies. It costs money to provide supports around education and employment. But the relationship piece has to be, I think, the third leg of the stool in a way, if you think about how affordable housing, supportive services for folks who want and need them, and community inclusion or social connectedness.
And I think that if you avail yourself of some of the workshops that are happening both today and tomorrow, you will see examples of communities that have come together with the type of leadership that it takes. I think that we've made a lot of progress here in Tulsa on those issues, huge collaborative efforts. I heard one about Philadelphia's collaborative initiatives yesterday. There's many examples. Take a look at the workshops that are available throughout the day here and tomorrow, and you'll be able to really hone in on some of those initiatives that work to reflect just that particular community, because there's some things that are specific that work better in one community than another. That's right. Linda's campaign shows tools that can be rolled out in many, many different communities that will work across the board, but there's also specific things that work and reflect the culture in your community. But I do have one more question for Linda. Of course, the goal for the 100,000 Homes campaign is to create 100,000 homes across the country and house 100,000 of the most chronically homeless and vulnerable individuals. But Linda, how many people have been housed across the country today since the beginning of the campaign?
20,600 plus people.
Over 20,000 people. That is amazing. So what I'd like to do now is a few more housekeeping issues, a few things that you need to know. Also, I want to remind you, we have our video showcase room, which is out here just outside the ballroom. We have a number of videos that have been submitted nationally and from the National Film Board of Canada on chronic homelessness, ending homelessness, on different models, different communities. Take a look at that when you have a chance. Also, I want to remind you to text housing. Like Jeff said, texting, everybody's walking around texting. But if you text housing to 69302, you'll get updates throughout the conference, information about the event. The breakout sessions that are marked on your schedules, that are marked conference hall, are located on the south end near where the registration was. So one set of the breakout rooms is down there by registration. Those are marked conference hall, and the named rooms that have names like Brady, Riverside, Utica, Brookside, those are over here on this other end, on the other side of this main ballroom as you exit to the left. Our coffee break this morning is sponsored by Creoaks Mental Health, which is one of our local mental health providers. Thank you very much for that. Coffee stations can be found out in the gallery area outside the ballroom. Refreshments can also be found on the opposite end of the convention center near the conference hall breakout rooms. Now, the convention center staff has a very short time to completely transform this room to get ready for lunch. Again, we have Mark Vonnegut. We're really looking forward to Mark Vonnegut being interviewed by one of our NPR radio personalities here today for our lunch plenary, but they have a very short amount of time to get this room ready. So please take everything with you when you leave the room and make your way out into the hallway quickly so everybody can begin to set up. And lunch will begin in this room at noon. Thank you. Thank you, Jeff. Thank you, Linda.
Listen to these house people now. Get out as fast as possible.